Cocaine, marijuana, codeine, Colorado, and quite a whole number of substances have negative effects on those who use them and also on the society. That's what we'll be looking at today. Our topic is substance use prevention. My name is Omololu Rosonwo, and you're welcome again to Talk Point on Lagos Television. Quite a whole lot of things happen in the society. Some things happen that ordinarily, when you want to do them, you don't get them done. But once you're on high substance, when you are on influence or under influence of drug, those things get done faster. If you look at what happens in the northern area and also people that kidnap around, they do not want to do it on a normal day, but because they use certain substances that gives them high knowledge and high power to do quite a number of things, they get it done without minding all the consequences. Today our focus is also on substance use prevention, and I have a lady in the studio that will be doing justice to that with me. She is Dorothy Tubo-Agiobu. She's the public relations officer of the International Society of Substance Use Prevention and Treatment Professionals, Lagos State Chapter. How are you doing?
Thank you. Good afternoon. I'm fine.
Nice having you on Top Point on Lagos Television.
Thank you, sir.
I guess, privilege. Yes, it's one of the things that we do here to ensure that we will bring topical issues that help society grow. You're welcome to Talk Point again on Lagos Television.
Thank you, sir.
Yes, in my opening introduction, I talked about use of drugs, use of substances that have negative effects or attendant effects on the society and also on those that use them. So if we say substance use, what do we mean by substance use? Can you just explain that to Nigerians?
Okay. Thank you all for having me here once more. When you say substance use are those substances or drugs that you use that gives you negative effects to your body or that are prohibited. Those substance use can be hard drug, it can be controlled drug, it can be also drugs that are not easily accessible unless it is being recommended by the specialist.
Well, yeah, okay. I seem to be interested in that. Are you telling me now that there are some substances that some specialists can recommend for you to use? Is that what you're saying?
Yeah. Like there are some mild sleeping drugs. You can recommend it for someone, but when you overuse it, it's a substance use.
Oh, okay.
Do you understand? When you take as little as volume 5.
Valium 5?
Yeah.
Okay. Is that
it's
a substance?
Controlled
or is it a controlled drug?
Cocaine is a hard drug.
Okay.
We have varieties of substance use drugs. We have the cocaine, we have heroin, we have the cannabis, what we call Indian hemp. We have the ones that are easily gotten, like alcohol too. It's a substance use. When you use alcohol and you use it excessive, it will still give you the same reaction that hard drugs gives you.
Oh,
yeah.
Okay. So, okay, I understand now. I'm sure Nigerians also understand what you mean by that. Now, we know that some substances, just you mentioned, of course, you also mentioned marijuana, just like I also talked about it. You also talked about cocaine. Now, we know that some of these things have its attendant consequences. Now, what are some of the causative effects of using some of these hard drugs? The causes, the causative effects, the causes.
The causes, you know, our youth nowadays, even the adults, they want to go high. They want to feel as if they are on top of their game or want to do what they naturally cannot do. So they take substances like stimulants or those depressants, depending on what they want to do part time. They take stimulants, they take depressants, they take drugs that makes them high, that makes them to hallucinate, to do things like Colorado now is a drug, deadly drug that everyone, every youth should abstain from it. When you take Colorado, it will make you to do what you are not expected to do. It will make you to run mad. You see them going to the gutters, putting their heads on the pit, doing as if they can touch the roof, they can touch the high tension. They, at that point, they are no longer themselves. They are being influenced by the use of that. So cocaine is good. People use it to keep pains positively, but the excess use of cocaine, it makes you to do things. It affects the central nervous system of the body and also gives you negative effects to act negatively beyond your imagination. So what is meant to do positive things in your body, when you overuse it, when you are not using it the way it's supposed to be used, you act in the reverse state.
You talked about depressants. When you say depressants, are you saying that there are some drugs that can be used?
Yeah, like India hemp. India hemp is a depressant, also a stimulant, depending. You see, some people feel that when they are angry, they need to take something to cool themselves. When you take India hemp, somehow it depresses you, cool your brain down. But when you take it excessively, you act in a reverse state.
I seem to be interested in that. I think we should just push a little on it. Now, we know that the National Drug Law Enforcement Agency is against the use of Indian hemp, what you call marijuana. The NDLA is against it. So why should I be using what they are arresting people for? To say, okay,
you are not supposed to use. In our country, Nigeria, it is prohibited. But other countries, you see some other countries, you feel that they allowed India hemp because they use it as depressants. But the law here does not allow it. So because we use things in a reverse state, what it is meant for, to cool your brain, what it is meant for, to relax your nerves, when taken excessively, it makes you to act negatively.
Okay. So indirectly, Indian hemp in some countries are laxatives.
Yes. They are laxative, yeah.
Okay. Yes,
they allow it.
Some years back, I recall that in Canada, they legalized Indian hemp. They're growing it. I'm wondering if that's, because from what you have just said now, if it's grown in Canada and used as depressant, and is grown in Nigeria and is used as something else and is banned.
The law here does not allow it. So we are following the law of the country. Okay. So that prohibits the cultivation, the production, and the use of India hemp.
Okay. Now, what can we do to prevent some of this usage of this high drugs and these stimulants that you talk about?
Okay, that is why NDLA is there and other organizations, private bodies, helping to teach our youth, going to school, going to the community, going to churches or the mosques or gathering to teach them on the negative effects of this hard drug.
Okay.
They have to be educated, they have to be informed, because India hemp or hard drug or the use of substance is a global issue. It's a global problem, irrespective of who you are, whether you are poor, you are rich, you are young, you are old. It affects everywhere. And it is the genesis of the problem in this country. Because when you use hard drug, you act abnormally and you commit crime. All the persons or people that are committing crime, when you check and find out what prompted them, what gave them that confidence to go into that act, you will see that they have used substance.
So indirectly, you are saying now that even the kidnappers,
They are all in the influence of drug or the usage of substance.
Yeah, I want to commend the government for clamping down on the use of these drugs, and I also want to appreciate people who also talk against the use of this, just like we're doing at Lagos Television too. But let me also ask this question. We know that we have children, and when you have your children at home and you are seeing certain signs, could it mean that they're using this drug? And what are some of these signs that parents or wards can watch out for when this thing come up?
As a parent, when you see your child feeling lonely or going to his or her shell, is no longer active at home and getting every time sleeping, feeling lazy, every time you see him coming down in academics in his school or in his performance, and he's no longer being active in what he or she does. When you see those signs on your children, just put an eye. Do a thorough check in their rooms. You will see maybe the fingers are chopping up, the lips are getting dark or reddish, the eyes and feeling funny. Just go through and talk to your child. You will see that either he or she is being influenced or being talked to using one of the substance or the other. It starts gradually. But when you put your eyes down as a parent, you will notice it early and curb it.
So, some children are very, very, let me put it this way, they are very good at acting. You understand? They use some of these things and they do not even let their parents have inkling into what they are doing. Now, in these situations, how do you know if they're using it or not?
You will definitely know. I can't have a child and my child just changes in his or her behavior and I will not notice it. I will notice it, especially in his performance, and get in rude. You see them, sometimes they talk to parents as if they don't even know that it's their parents they are that they are talking to. When you see your child talking on his or her voice, shouting at their parents, you know that that child is being on the influence of drug.
Okay.
And every time chewing gum, trying to suppress the smell around.
Okay, that's another way.
That is another way.
When they chew gum
often licking sweet or chewing gum is another sign. It doesn't mean that is the main sign, but it's giving you a lead. You find out what. And the lips, every time it's licking the lips, licking it for it not to be dry, you know. Check the fingers, check the eyes, check the performance in the school or at home. Dozing every time when you call him or her, no. And when you go close to that person and he talks to you, you see the smell. You will definitely perceive the smell.
Just like somebody that takes alcohol in excess, once you move closer to the person, you will perceive
the smell.
Okay, so that can also happen.
When you are using substance.
Okay, as professionals, you must have seen some of these things happen. Now, could you just relate some of the experiences you have seen and how you have been able to kind of prevent and probably recover these children from things like this?
Okay. By privilege, I am an officer of the National Drug Enforcement Agency.
Okay.
Then I went into training as an ISOP that brought me here.
Okay.
The International Substance Professional Body that brought me here. So As an officer, we are able to dictate when you see there's an natural instinct. When I see a drug user or a substance use disorder person, in ISOP, as a professional, you don't call it a drug user because the language is so harsh, and they won't be very happy to be identified
as drug addict, right?
or user.
So what do you now call them?
Substance use disorder.
Is it not the same thing?
No, it's more friendly to avoid stigmatization, to avoid them being looked as if they are doing something bad.
Are they also doing something bad?
Sure, because you want to help them to recover. I am more now into treatment and recovery as a counselor.
Okay.
I want to dwell on how to see that these persons are out of the use of substance and how they can recover totally and be integrated back to the society. That is what I am focusing. I know as an officer I'm supposed to, when I see them, apprehend them, put them, but I have passion, empathy, because drug using, when someone is addicted, is a brain disease. That person is no longer the person that you know. Is being influenced by the use of that substance, and it has affected the person's brain. It's a chronic disease. Do you understand? Addiction is a chronic disease that is characterized by drug seeking. They seek for drug or the usage of drug, irrespective of the consequences. They don't care what is going to do, the consequences in their life. They still go into it because they want to achieve that purpose, that aim that might be ill to the society. Armed robbery, kidnapping, terrorism, prostitution, and name it. All this are being characterized by the uses of the influence of drug.
You seem to have passion. I'm looking at your face and I'm seeing the passion, because at some point when you started talking, empathy, that, I was just looking into your eyeballs to see that concern. Now, in situations like this, you have seen some of the things that happen. Have you been able to recover them?
Okay, by God's grace, I'm into it. And when I see person under the influence of drug, it's for me to empathize with the person and bring the person closer. Have a psycho talk. We call it psycho education. Tell the person the consequences of this and let the person see his or her future from this aspect. How do you want to see your life? Do you want to end this way? No, I love you, so I can help you out of this. So if the person is free, because the person has to be willing first for treatment, he has to be willing to give away that habit, then I will take the person up and see that using the steps that I'm being taught. When the person comes, then we'll use those processes and bring the person out of the use of substance and see that the person is recovered totally and being integrated back to the society without stigmatization.
God forbid I will not use drug, you understand? But let me use myself as an example. Now, if I'm into drug use and I continue to use it and you have approached me and I think you want to help me, and I continue to use the substance, won't that discourage you? Because if I continue to use it and you want to treat me, how do I get out of it?
Treatment is not a one way off. It's a continuous process. It's step by step. If the person takes a puff or takes a cigarette, let me take cigarettes, takes maybe 3 packs of cigarettes in a day, and the person reduces it to 1 pack, there's progress. Treatment have started.
Okay.
Yeah. I will allow the person. I will encourage the person, give the person a clap, and say, good, you are doing well. Why can't we go to this, reduce it to half, reduce it, because you cannot stop it at a drugs, no? It's not possible.
It's a gradual thing.
Gradual process. Yeah. So until we get to the end of recovery, I have not achieved my purpose. So I will stick to it until I get it.
So yes, in these situations, as we continue to want to start to round up now, how long does it take for one to recover? If you have a patient that you're trying to treat, how long does it take?
From 6 to 1 year, I should be able to see some signs of recovery. It takes, it's not just a one-day thing. 6 months, I should be seeing sign to 1 year. That's not 2 years, you should be out of it.
Okay, that's a good development. If you can do that in 6 months to 1 year, to actually want to bring them
to stability.
To stability. Now, are there, as we round up now, is there any collaborative? You have revealed that you are also an NDLEA official, which is good. Now, are there collaborative efforts with other agencies? Because I know NDLEA is also in the forefront, the vanguard of pushing people out of drugs. Now, are there collaborative efforts as we round up?
Yeah, in Nigeria, NDLEA is the body that the government has empowered to take charge of this. We have international bodies, the United Nations, the UNODC, on prevention, and to see that this thing does not come in and people don't take it. Then in treatment, we have other organizations. They are all international bodies helping Nigeria to see that rehabilitations are being built. We have private rehabilitation and government rehabilitation where we take people. When you come to NDLEA, we have a counseling section, we have the rehabilitation center too. If the place is not enough, we refer you to, depending on the severity and depending on the situation. We have the psychiatric hospital, we have the social workers. There are so many organizations here to help that this drug is being prevented and people are being treated.
Finally, what's your advice for people to avoid substance use? Your advice?
Substance use is not a thing to go into. It's an addiction that is chronic to everyone, and when you go into that, you will not be able to perform your activity at your optimal stage. Your workplace will suffer, your family will suffer, everything about you will suffer, and the country too will be at a dark image. So I will advise the youth, for you not to be influenced by this, you should know who are your friends, because most of the persons that go into this are being pressured by their friends and social media. They all have bad consequences on individuals, and it will be so bad when you are into it, and it will be very, very difficult to come out of it. So addiction or drug use is not a thing to venture into.
Okay, yes,
there are so many things you can do with yourself.
Yes, it's been Talk Point on Lagos Television, and we've been talking on substance use prevention, and my guest has been Dorothy Tubo-Agiobu, a substance abuse prevention advocate and also an officer of the National Nigeria Development NDLEA, the National Drug Law Enforcement Agency. I want to thank you so much for coming on board, Dorothy. Thank you. You don't, I must say that you don't look like an officer.
Yes. I came in the umbrella of international substances.
Yes, it's okay. I want to thank you so much for being part of Talk Point. On that note, we have come to the end of Talk Point. 767 and 112 still remains the line to always call in times of emergency. Stay out of trouble. Avoid use of substance, drugs, and things that can turn your life negatively. Be positive and do things that will make Nigeria and yourself get better in life. I am Omololu Rosawo saying bye-bye.